One.
Good afternoon, good morning, and good evening. I'm Celia Lau, Professor of Anthropology and International Studies and Director of the Southeast Asia Center at the University of Washington. I study the environmental humanities, including pandemic outbreak in Indonesia. Welcome to Situating COVID-19 in Southeast Asia. Today, our panelists from the University of Washington and across Southeast Asia will be discussing the pandemic, which we're all experiencing at a global scale. We're live streaming our event on YouTube and will take questions from the audience at the end of the presentations. I will introduce each of our speakers and moderate our discussion. Before we begin, I want to thank Shannon Bush, Michael Wallstrom, and Ben Marwick for the help they've given in getting this panel going behind the scenes. So thank you very much. Thank you also to our speakers. And our first speaker is Professor Surya Afif. She is Associate Professor of Anthropology in the Faculty of Social and Political Sciences at Universitas Indonesia. She studies resource access, labor migration, and agrarian change in North Sumatra, and is well known for her agrarian and environmental advocacy activities with Indonesian NGOs.
I should unmute. Thank you, Celia, Michael, and Shannon to organize this panel. My talk will be a focus on response of the government and people in Indonesia dealing with the coronavirus pandemic. Due to time limit, I will try in this 5 minutes or so to briefly share some of the insights from my own country. Despite on February 15, two Indonesians' closest neighbors, Singapore and Malaysia, already announced they had coronavirus cases, Indonesian government was still in denial, even when Harvard University Public Health runs a report predicted coronavirus was already in Indonesia. On February, the Minister of Health felt insulted with the report, responded that it was due to pray why country had zero case of corona. This is not the first time the Indonesian government has slow response. During the 2006 bird flu outbreak, Indonesia officials also reluctant to act fast. WHO has to intervene, and with the US government financial support, the Indonesian government finally agreed to establish a special task force to deal with the outbreak. I'm afraid Indonesia will take more longer time to deal with the corona pandemic compared to the other Southeast Asian countries. This failure, not only just because the government late to respond, but also due to the factor related to the poor coordination among the government. Some officials lack sense of crisis, ambiguity style of communication, poor leadership, corruption, inefficient bureaucracy, to name the few. The fundamental problem also refer to the weaknesses in the health sector, which depicted by the surprising low of testing performance as it's shown in the following table. Many of these problems, of course, are not new. It exists before the pandemic hit the country. Moreover, concerned with the economic consequences and afraid of the possibility to have social unrest might also contribute to the government fail to act effectively. On the people side, I would like to mention 3 points. First, it's about how people react to the coronavirus disruption that affected their life. Story related to the religious community is one of these examples. All major religion in Indonesia have activities usually involve mass gathering. Closing of the place for worship to prevent the virus transmission has forced some of them to express their frustration and anger using the narrative of virus versus code. Next slide, please. As we can see in the following banner. Next slide, please. People need time to process this new normal to do worship for home. However, few people are still struggling to face this reality and have reluctant accepting the rule. The month of also the holy month of Ramadan for Muslim here in Indonesia and elsewhere. The end of Ramadan, usually a million of Indonesia will travel to visit their parents and family to celebrate Idul Fitri. This ritual called mudik. People now were urged to not going mudik, but not all people could afford to stay in the city without income and without guarantee will receive government assistance. So they try to find ways to go mudik, even they know it might harmful the family they visit. They say, it better die in my hometown with family and friends, rather here in Jakarta, I might die alone from hunger. It's difficult to tell people about potential danger of their action when they do not have a collective memory of the past pandemic. Even more difficult in the case of coronavirus, because some people who catch the virus, but without the symptom. The second point that I would like to highlight is related to the emerging of solidarity in Indonesia in response to the pandemic. Next slide, please. Indonesia has a special term for solidarity. It is called gotong royong, which is based on voluntary participations, sharing, and generosity. Some people believe the spirit of gotong royong has been eroded in recent years. Yesterday, Kompas published this article that pointed out the fact that practice of gotong royong is still very much alive and very crucial in Indonesia's ability to deal with the novel coronavirus pandemic. Coronavirus helped us in Indonesia to revitalize this most important value for Indonesians. The last issue that I found interesting to briefly mention here is about how stories from other countries are perceived by the Indonesian audience. For example, recently, the conspiracy theory of the virus, that the virus was fabricated and vaccine is a scam, has been circulated throughout social media. In fact, the stories originally come from the US. In the past, stories like this usually will easily attract a large followers in Indonesia. It seems during this pandemic time, people is more careful to believe that story like this one should be not to be taken seriously. Finally, I'm eager to learn experience from the other panelists today about the insightful story from the perspective, from your perspective country. As I think my time to talk has passed, I should stop now and thank you for the attention. Thank you.
Thank you, Professor Surya. Next, we have Professor McCallaghan, who is Associate Professor in the Jackson School of International Studies and works on Burma. Her areas of interest are comparative politics, South Asia studies, and civil military relations.
Thank you, Sonja, or sorry, Celia. I am going low tech here. I don't have a PowerPoint presentation, but I have about 3 points that I want to make. First, Myanmar has detected only the mildest of outbreaks, with 188 confirmed cases as of 3 o'clock this morning. And only a couple of sizable clusters. And what's notable in a country that has many huge, well-attended Buddhist sermons that tend to occur between January and April every year, none of the clusters have come out of these Buddhist prayer meetings. So lots of foreigners, but also lots of Myanmar people talked about denial, and it's suspected a cover-up. I increasingly am leaning away from that, at least for now. And the main reason is this: Myanmar is a country like others in Southeast Asia that is addicted to Facebook. And if COVID had hit this place hard, it would likely be reported and shared widely. There would be messages of commemoration, rest in peace, all of that sort of thing. So I am not totally convinced that it's here in large numbers. So if it's not, then why not? If you think about it, Myanmar shares the longest border in mainland Southeast Asia with China. It had tens of thousands of migrants in China who fled back at the Lunar New Year. But in general, Myanmar is still a very isolated country. Even with the dramatic increase to a few 100,000 Chinese tourists last year, Myanmar is not really much of a hub for travelers or transit, unlike Bangkok or Singapore. And whereas Burma had about 300,000 travelers from China last year, tourists, Thailand had tens of millions. So it's a real question of scale. Second, in terms of why not, we just don't know what's going on epidemiologically. Testing is absolutely minimal. I think it is possible that a fair number of elderly folk are doing what they do in rural Southeast Asia, that is to say, dying of respiratory diseases and sepsis. If there's an official around to issue a death certificate, and that's a big if, given how much of the country is not really ruled by the central state, the cause of death is probably listed as pneumonia. And the third point, I think, is that Myanmar's historical health metrics suggest that we've just passed through the most robust period of every year, the cool to the hot season. When the rains come, and they're coming right now, that's when illness arrives. So we have no idea whatsoever when much of the population faces comorbidity factors like chikungunya or dengue from June to August, what will happen. So third point is just the title of the presentation, Situating COVID here. So far, the hegemonic narrative here is that it's an outsider's disease. When Myanmar parents and grandparents learned of what was happening in China by February, they insisted on their kids returning to their rural home places, not just from China, but everywhere, including Myanmar industrial zones outside of cities. A small number of returnees tested positive for COVID-19. But from the government's own statistics, in reality, what's happening here is community transmission. It's not an outsider story. But that is exactly the story that everyone tells, is that tens of thousands and maybe more of migrant workers who've lost their jobs in Thailand's and China's decimated economies, or Yangon's closing factories, they are no longer the heroes they used to be when they sent home remittances and brought motorbikes or smartphones home every New Year's festival each April. Whereas they used to be the absolute economic foundations for the rural economy, they are now the dangers. Many are trying to return home, mostly to rural villages, and they will get locked up like zoo animals in some places. Not all, though, but they will be, for the near term, dangerous outsiders. This, without question, will wear Myanmar's already threadbare social fabric down to its last thin threads. And a final note, some foreigners are also finding that they are being stigmatized and are having, they're not able to buy highway bus tickets and they can't find places to stay. So thank you for your time.
Thank you, Mary. Next, we'll hear from Professor Reti Cham, who is a medical doctor, science diplomat, educator, and historian with extended experience in digital science and technology, global health diplomacy, nuclear technology policy, and executive education. In May of 2019, Professor Cham was appointed by royal decree minister delegate attached to the Prime Minister of Cambodia.
Thank you, Celia. Good morning, everybody, or good evening. It's a great honor, pleasure to be here. Thank you for organizing this wonderful seminar. So as I mentioned to you, I'm here more as a scholar. I'm a scholar at heart who end up accidentally in the government. But so I'm doing my life is a kind of a participant observation. I think cultural anthropologists will love that. This is the first time that I'm involved actively, directly with a global health disaster. 10 years ago, less than 10 years ago, I was heavily involved with the Fukushima nuclear disaster. So if you look at Cambodia with our limited resources, but we got the royal government get good advice from WHO, and we work closely with the Institut Pasteur Cambodia. Institut Pasteur has a long story in history in this part of the world. And we got advice from the US CDC representative Cambodia. With this combined international support, we were able to manage the first phase of the pandemic relatively well, to our surprise also, but we've been very, very disciplined. We listened to scientists, we listened to specialists, and we got 122 confirmed cases. I know that, and 2 days ago, 122 has fully recovered, and no new case for more than 32, 33 days now. So now with this first, we can call success, we are fully aware that the second wave, eventual second wave is coming, so we don't let off our guard, mean that restriction, non-pharmaceutical intervention is still active and the rapid response medical is still there. So because of my background, my interest, I like to share with you a narrative about the global health diplomacy as a case study in Cambodia, focusing on the Westerdam cruise. You have heard about that. So the Westerdam cruise was left Hong Kong sometime early February, and after roaming in the sea for almost 2 weeks, no more food, less water available, they have been trying to dock in many countries, but their docking has been denied in Japan, Philippines, Taiwan, Thailand, and the territory Guam of the US. And so on board, there were 2,257 people, 41 nationalities, a sizable number of American citizens, 802 crew members, and 1,455 passengers. And with this, with the advice of the WHO, US CDC, Pasteur Institute, and the Cambodian medical team, we allowed this cruise ship to dock in Cambodia on the 13th of February, 2020. The triage was done through a maritime declaration health that identified 20 passengers out of the 2,000 who were all tested negative for coronavirus, and all costs of screening and everything are covered by the royal government of Cambodia, and all passengers flown home, they got quarantined, and nobody got sick at all. So with this, it was quite a good start, and Cambodia decided to move to resolve this as a humanitarian crisis in line with the international health regulations that offer guidelines regarding the proper practice of international traffic and screening for infectious diseases at ports of entry and exit, patient management and surveillance according to Article 43.1 of the IHR, and the rescue of the people from the Westerdam cruise was also conducted with, I quote, a full respect for the dignity, human rights, and fundamental freedom of person, Article 3.1 of the IHR. By refusing the docking of a ship in distress, other countries may not meet the basic human right requirement, especially when their own citizens were denied the right to return home. Coincidentally, 2 weeks later, the Lancet underscored this position in an article entitled, "Do Not Violate the International Health Regulation During COVID-19 Outbreak." So global health diplomacy is a practice of a diplomacy where health and foreign policy have been intertwined for a long time, but more recently, transnational health issues have become one of the top priorities of the global agenda, and this pandemic is one of the striking examples. So more than 2,000 people with 41 nationalities were repatriated safely to their respective country. This success story, small success story, casts Cambodia in a positive light as a global player in global health diplomacy. You know, we have been in the press identified as a dark horse, no respect of international law. I think there's an article in the New York Times saying that Cambodia negligence and complacency will lead to, but the result of this case is a case study that is worth of consideration. And Cambodia has led by example and has shown that in the midst of severe viral epidemics, by that time called epidemics, that a one small state with limited resources can contribute to the resolution of a complex international travel restriction in line with the guideline from the International Health Regulation, the WHO. And this also, you should question the humanitarian aspect. 2,500 in the sea with the fear of the virus, food running out, not allowed to dock. Our government decided that despite this, the limit of our resources and the fear of that probably driven by, at this point of extreme human condition, that maybe Buddhism value should prevail. So protecting health for all required an international collaborative effort between those who were victims of the disease discrimination and their saviors. Thank you.
Thank you very much, Professor Cham. Now we will hear from Professor Huang Te Xiu Hien, who is a nurse educator with an interest in global health, community health, and health promotion. She teaches nursing at Seattle colleges and has worked on HIV/AIDS prevention, care, and treatment, and in community development and reproductive health internationally.
Thank you, Professor Low. And I'd like to thank the Southeast Asia program at the University of Washington for organizing this panel. First, I just want to mention that even though I'm a nurse and a public health professional, I am here today more as an observer than anything else. Since we have been in lockdown here in Washington State for a couple of months, I've lost track. We have moved from in-person teaching to online, and I have to confess, I haven't had a lot of time to focus on following the news and following the pandemic as to the extent that I'd like. But here's, so first I would like to present to you the fact, as I know it, of the COVID-19 situation in Vietnam. Currently, as of today, the number of confirmed cases in Vietnam is 324 with no death. And how the question has been going on around from many quarters. How is Vietnam doing this? Can we believe this number? Is it true? And what I can say is just like Professor Callahan said, if in fact we have the number of cases are a lot more than this, we would have known. There are many foreigners, many Westerners living in Vietnam, many of us who are of Vietnamese descent who live elsewhere in the United States, in France, Australia, everywhere else in Europe, have family in Vietnam. We would have known, but most of us are not touched by COVID-19. If anything is that we have family members who take care of people who have COVID-19. And so what is the reason for this success? First of all, Vietnam got its first case on January 23rd, which is the day before the Tết celebration, the biggest holiday in Vietnam. And the government of Vietnam took decisive action right away. It isolated the case, contacted everybody associated who had contact with the case, and closed down all the schools. All schools in Vietnam had been off. Students have not been in schools for the last week of January, all of February, March, and April, and they just returned to school at in the second or first week of May, so just did. And because the schools were empty, the government actually used these the dormitories at for the university as quarantine centers for a lot of people who have, especially people who have been repatriated from overseas. But the second reason for this success, I believe, is that the top leadership of Vietnam have given coordinating authority to the Ministry of Health and other public health professionals who know what to do, who have had experience, who have had knowledge to manage a pandemic back in 2003, 17 years ago, dealing with the SARS epidemic. Also started in China, but hit Vietnam, and it was first discovered what it was in Vietnam. So the pandemic has been managed by health professionals, and the coordinated efforts were in conjunction with WHO, the US CDC, other multilateral, bilateral, and private partners in Vietnam. They've tested every single case. They traced and contacted contacts of people who've been confirmed or presumptive COVID-19. So how does that, so the government is now quite, and the population is now pretty confident that they know exactly where the people who are infected are, how many people are infected, and have it contained. Since the country has reopened now for I think 21 days now, they haven't had new cases for more than 30 days. Anyway, so before all this happened, there has been a lot of tension between the Vietnamese government and its citizens about many things. But when this happened and the way the government did it, the whole country felt that it was together with the government. The people are very proud of the way Vietnam has been handling the pandemic, and especially because of the viral video that has been circulating around the internet internationally, and the Vietnamese people have been feeling as if they are in this together with their government, and there is a new narrative that maybe we have something to be proud of after all, even though we're small and poor.
Wonderful, thank you so much. Now we will hear from Mr. Pisit Plong, who is an archaeologist and anthropologist of Cambodia. He is currently pursuing a Doctor of Education degree in Leadership Education Management with the University of Western Ontario in Canada. And he has worked for the International Atomic Energy Agency, the Cambodia Development Resource Institute, and the World Bank. You may need to unmute yourself.
Hi, sorry. Good morning from Phnom Penh to everyone. I would like to start by telling a bit about what's happening here. As in the first case of COVID-19 in Cambodia on the 27th of January 2020, we found 122 people infected with COVID-19. And as of Saturday last week, all these 122 patients were cured. There are many interpretations about the successful treatment and the low infections in Cambodia from medical point of view, also from political point of view. But I would like to connect these low infection cases and spread of COVID in Cambodia to 2 points here from the anthropological viewpoint. One is a culture of wearing masks, and second is the traditional local practice. So actually about culture of wearing masks, mask and culture of wearing masks is not new. The surgical masks were first introduced in hospital in late 18th century to prevent patients patient's surgical wound from droplets released from surgeon's breath. And also face mask was created by the Chinese doctor in around early 1900. In Asia, wearing mask is common. In East Asia, mask is used in public widely, outside hospital settings, as a way to protect oneself from dust, heat, which may affect one's face of duty. For example, in Japan, wearing mask became a culture among youth, and it's also worn as a cosplay. Japanese women wear masks to avoid getting suntanned in order to look more Western, to hide their face makeup or emotion, and to get rid of unwanted communications or harassment. In Cambodia, a scarf is traditionally used as part of daily life. It is used for many purposes, for bathing, skirts, towels, to wear on head or face, to protect oneself from sunlight and heat. It is also used to cover mouth and nose in dusty environment or road. It serves similar functions to face masks. When COVID-19 outbreak started, people are self-aware about mask use, and masks were brought out from market, local store. And in campaign against the COVID-19, the Prime Minister even promoted the use of scarf and practice of the sampeh rather than shaking hand or hugging when face masks and surgical masks were shortage and risk of virus COVID-19 contagion is uncertain. This is such a psychological strategy to prevent mask price from skyrocketing and panic in community among shortage or lack of masks. If you ever visited Cambodia before the COVID-19 outbreak, you may not be surprised seeing people riding motorbike or taking tuk-tuk by wearing masks and helmet in addition to long sleeve shirt, because it is a way to protect themselves from dust, heat, and bad smell from vehicle smoke. People wear masks in Cambodia because it helps their health and protects their beauty. Now I would like to talk about the local practice and response to COVID-19 from Cambodians' cultural practice point of view. It is common that one would see scarecrow in rice field in South Asia. Scarecrow look like a human being from distance. Thus, it can easily confuse birds and insects to stay away from the fields or from the areas. The modified concept of scarecrow expand further beyond farmers' idea to chase away or fear birds or insects from rice fields. In villages or areas which have widespread plagues, cholera, or disease of unknown sources which may result in human or animal death, villagers believe that it is caused by bad evils or spirits. To avoid bad luck or disease to their families and village, villagers would scare away those bad spirits with modified form of scarecrow called Ting Mong. By setting up and install those Ting Mong at the individual house gates or entrance, in believing that those Ting Mong act as guardians to protect their house and family. In these pictures on the far left, you see that this Ting Mong is dressed up like scarecrow in modern dress, wearing helmet, mask, holding objects like swords and gun. Interestingly, it has also the label which reads "Corona, go away." We see this sort of Ting Mong across the country from time to time when people believe that plagues or disease or bad evil may cause human and animal death. This time, and like at the previous situation, villagers set it up in believing that COVID-19 is bad creatures or evil, and it would be away and life would be safe. In conclusions, I would like to stress that culture play a role in response to COVID-19. Mask is well accepted and widely used since the first announcements of COVID-19 pandemic in Cambodia in late January. Though masks were almost bought out from market and mask price were skyrocketing, hence traditional use of trauma gave space and time and space for government to respond and to assure people about COVID-19, and they used panic among public about mask shortage. The traditional practice and belief in Ting Mong underlies some trust psychologically for fighting against COVID-19, though it is not scientifically proved to be effective, but it helps people to believe in overcoming COVID in the future because bad evils is usually defeated at the end. Thank you. It's the end of my presentation.
Thank you very much, Pasit. Now we will hear from Professor Vince Raphael, who is the Giovanni and Omni Costigan Professor of History at the University of Washington and who works in the Philippines.
Yeah. Hi, everyone. Although thanks very much for organizing this, Celia. This has been very, very informative, and I'm very grateful for everybody who's managed to come on and talk a little bit about the situation in their communities and in their countries. In my case, I'm sort of in this in-between stage because, of course, I'm on lockdown in Seattle, but I have been trying to follow the news in the Philippines. So whatever I know or whatever I can say about the Philippines is heavily mediated, principally by the news media and by information that I get from friends and from family, from newspapers, official pronouncements, as well, of course, as Facebook and Twitter and all the other social media platforms. I think the case of, just listening to everybody on this panel, the case of the Philippines is a little bit more similar to Indonesia in a sense that we've had quite a number of cases. As of today, there's roughly 12,500 cases of COVID-19 that's been reported. And out of those 12,500, there's been about 850 deaths. And so really it's on the other far end spectrum of Myanmar and Vietnam, as some people have talked about, and even Thailand. The reasons for these differences are not going to be very surprising. You have a situation where you have, first of all, a very late attempt at controlling population movement and locking down. You have a situation where you have enormous numbers of Chinese nationals who were coming into the Philippines during the height of the infection around January, February, and the Duterte administration was very, very reluctant to regulate or shut down the flights from China. And a lot of this has to do with the fact that the government is very, very friendly with the Chinese for all kinds of complicated reasons. So that's one of the reasons. The other reason is that the government response to COVID-19 has been very much continuous with their response to the drug war. So if there's anything that's framed COVID-19, it's been the war on drugs. And like the war on drugs, the emphasis has been on policing, has been on militarizing, on rather draconian measures to prosecute offenders of the lockdown, and treating those infected as if they were guilty of a crime. The way, for example, drug users are treated as if they were criminally liable for their actions. And the problem is that, again, as in the case of the drug war, what's happened with the government response to COVID-19 is it's emphasized the disparities, the social disparities, whereby it's the poor, those who live in slums, etc., who are affected most dramatically by the lockdown, and the rich are able to, as it were, get off scot-free, or government officials are relatively left off. The result is that you get the sense, at least from my own reading, that insofar as the majority of the people are concerned, at least the poor people are concerned, they are far more afraid of going hungry than they are of getting infected. Because for them, that's the immediate thing. You know, being on lockdown means that they have no access to food. Government services have been very, very slow. There's been an attempt on the part of the Department of Social Health to provide immediate cash payments of something like, I don't know, 9,000 pesos, about $98 to certain communities, but it's been very uneven. And as with all attempts at cash transfers, there's lots of inequities and lots of irregularities. So people are left feeling that the virus in some ways poses less of a threat than hunger, right? And it's because of this that there's been a lot of attempts to sort of find food, break out of the lockdown, which in turn sort of attracts policing, more draconian measures, people being put in jails, and so on and so forth. Whereas public officials are able to go to parties, go to birthday celebrations, you know, there's pictures of them on Facebook, and they suffer no consequences whatsoever. So you can imagine the social kind of unrest, or at least the social dissatisfaction. I wouldn't say unrest, but at least the social dissatisfaction that this has stirred up. Again, very different from Vietnam. I was hearing about Vietnam is the sense that people come together, they seem to be united. There's a certain degree of trust with the government, which is very similar to Taiwan, Korea, and various other places. In the Philippines, I think what you have is a lot of distrust, a lot of unhappiness. And so it's very difficult for the government to, especially public health officials, to coordinate efforts to address the COVID-19 situation. Now, with the few minutes I have left, let me just say what the situation is today. As in many places, there's been an attempt to sort of walk back the lockdown. Things are beginning to open up. The most interesting areas. So shops, for example, that provide essential businesses, restaurants where people can order takeout, that sort of thing, and shopping malls. Shopping malls have started to open up, and these have been very, very problematic, as you can well imagine, despite of attempts to sort of sanitize shopping malls. People have been very, very anxious and very eager to go out to the shopping malls. One reason is because it's air conditioned. And given the fact that people live in extremely crowded conditions, and it's very, very hot in Southeast Asia right now. So people are drawn to shopping malls, and there have been all kinds of complaints about, like the workers in the malls. They don't want to go home. They just stay there, because it's cooler, because they have access to food and so forth. So there's been some talk that maybe they're going to close them down again. And so I don't know. It's a day-to-day thing as far as these businesses are concerned. That's maybe I'll stop there, and if there are questions, we can entertain them later on. But I think the comparative connections are very, very interesting. Yeah.
Thank you so much. Our next speaker is Professor Anasorn Uno, who is Associate Professor of Anthropology and former Dean of the Faculty of Sociology and Anthropology at Thammasat University in Bangkok, Thailand. He has just published a new book, We Love Mr. King, Malay Muslims of Southern Thailand in the Wake of the Unrest, with IC's Press.
Thank you very much, Celia, and Southeast Asia Center at the University of Washington. Today, I'm going to situate the COVID-19 in Thailand. I try to situate it in Thailand's political and socio-economic context, trying to point out how the COVID-19 brought about another forms of coup d'etat, which helps consolidate the power of the unelected, undemocratic government, and suppress the dissidents. I will begin with the daily press conference of the CCSA, or the Center for COVID-19 Situation Administration, after being founded on March 27th, following the nationwide declaration of emergency decree on March 26th. The press conference on May 13th, is very significant, because this is the first day after the CCSA was founded that no new case was founded, or we have 0 cases on this day. And also there is no new death founded on this day. So the death toll for today, for the May 13th, is 56, and the cumulative cases is 3,017, with 2,844 recovering. And on the day, we have just only 117 sick people, in the hospital. And it's very interesting too, although it's not in this slide, that we have 50 provinces, that have no new cases for 28 days. And we have 1-digit number of new cases for 17 consecutive days. The number is interesting in that, because, this number, this day, this is this is the 10 days, after the CCSA has eased restrictions, because this is fall within the incubation period, 7 to 14 days. And this is after, 10 days of the easing of the restriction, the number is still low, as you see. But the problem with this is that despite the steady decline of new cases and also the death toll, the CCSA spokesperson on that day, brought the information and data to the other way around. The first one is that, there are cases, that they thought interesting, have been shown, on the press conference. The first one is the second round, outbreak of the pandemic in Wuhan city in China. And the second one is, the second round outbreak of pandemic in Korea. These 2 cases were cited, to warn or, in other words, to threaten, the people in Thailand not to be lighthearted by the low number of, the cases and death too. And this second point is that after, showing the situation in Wuhan and also in South Korea, the spokespersons of the CCSA, cited the report, on the violation of the curfew, which bans, being outside home from 10 p.m. to 4 p.m., 4 a.m. in the morning. There are 47 cases, that breach the curfew for, drinking, gambling, and also using drugs. And also, there are 497 cases of people who were outside their homes during the period, whether, on their errands, whether they're commuting back home or something. And it's interesting is that because this report was prepared by the center, the Operation Center for Remedying the Emergency Situation on Security, which has the Supreme Commander as the head. This center is the most active, center, from 10 offices center that were founded by the order of the Prime Minister number 6, as the arrangement of the structure of the CCSA. And in addition to this center, which was headed by the Supreme Commander, the other important center, of this is number 2, the Central Coordination Office, which the Secretary General of the National Security Council as head the office, because now the government, both of the centers, are headed by the general armies, and in addition to seeing those who violating the curfew, the important is that the remaining centers, the remaining centers of under this the CSA have the permanent secretary of relevant ministries as their heads. So it means that there are no ministers in charge in the CCSA, although the ministers are elected politicians from the coalition party. The question is why Thailand needs the emergency decree and also the CCSA that has no elected politicians. The first one is that this is the attempt to consolidate the power over the multi-faction, the government. At the initial stage, there were conflicts between 2 ministers, in charge, which were from different political parties. The first one is the public ministers, who's the leader of the Phum Chai Thai party. And the second one is the commerce minister from the Democratic Party. These 2 political parties, these 2 ministers, have conflicts over the shortage of surgical masks and also the hand sanitizers, because not only people in general find it difficult to get the surgical mask, and also it's very expensive, but also medical doctors, nurses, and medical staff were also facing the shortage of surgical masks. They have to produce surgical masks themselves, and there is a blaming game between 2 ministers. The public health minister says that the surgical masks produced by the government pharmaceutical organization is just only 1 baht each. But for the mass produced by the Ministry of Commerce cost 2.5 baht each. So there's a blaming game between two ministries, and they try to point a finger to each other. And so the Prime Minister General Prayut, he tried to stop this conflict by declaring the state emergency decree, and also founding the the CCSA, which in effect have by according to Article 7 of the emergency decree, all powers and duties of the ministers derived from 40 statutory laws have been transferred to solely the Prime Minister. So from now on, they have nothing to do with the situation. And the second thing is the Prime Minister also.
I'm gonna have to ask you to wrap up.
Okay. So we
you
have.
Say one concluding.
Okay. Yeah. Okay, we have the he tried to centralize the fragmented bureaucracy, and also they try to create special ministers and bodies. But anyway, although it seems successful, but there are also the collateral damages, either in terms of economic impacts, in terms of mental illness. We have the cases of committing suicide, at the same number of those who died from the COVID-19. And we also have homeless people who were arrested for breaching the curfew, because they were outside their sleeping places at the moment at night. And there are also political complications, because they used the emergency decree in impeding criticism of the way in which the CCSA handles the situation, and also they try to silence the voices of those who try to solve the problems. And this is the students of the Chiang Mai University attempted to submit a letter to University Council, to reduce the tuition fee, because their families were affected by the COVID-19 economically. But the police came and told them that the way they did that is the violation of the curfew, which banned the gathering of people. And also they used this to suppress the political dissidents. On the 14th of May, a group of people held an event to commemorate the killing of General Major Katia during the Red Shirt protest in 2010. But then the leader of the event was arrested, brought to the police station, and charged with violating the emergency decree for gathering. And
okay.
So to sum up, as the Thai people have been repeatedly told that the COVID-19 was put to an end by enforcing strict measures under the administration of the CCSA, which to me is the other form of coup d'etat. Thailand may survive the virus, but not the coup. Thank you very much.
Thank you so much as well. Okay, now we are going to move on to our question and answer section of our panel discussion. But before we do, I would like to just take a moment to recognize that we are talking about a pandemic. We're talking about a situation where there is death, there is sickness, and as some panelists mentioned, there's hunger, there is economic hardship. And so the discussion we're having is also, it's not abstract. It's something that's very much affecting many people's lives, even in countries where the case numbers are low. So I wanted to take a moment and just recognize that as the background for our discussion today. So do any of you have any questions for the other members of the panel? Something you would like to ask or something that you heard that sparked your interest and imagination, or a question that you would like to throw out for discussion?
Yeah, I would like to know, like, the reason why Southeast Asia, as a region have been, affected less when, compared to other parts of the world. If you take a look at, the map, and the world map, and you see, Southeast Asia with quite small numbers of infection. So I don't know why. Some people came up with a couple of days ago, Sombrangsi, right? He is a Cambodian, and he wrote an article saying that yes, there is like a hemoglobin E or something within, people of Southeast Asia that give them an immunity, to the spread of COVID-19. And there are also other, factors, but I don't know. But perhaps we can talk about this, as Southeast Asia in general.
Feel free to jump in. Yes, please, Reti.
Yeah.
Can you hear me?
Okay.
Yes.
Yes, okay. I think the question raised by Professor Anderson was raised by many people. This is a very interesting question from the biological, microbiological dimension, history dimension. Nobody would have the answer, but when we look back in 1 or 2 years, that's the role of microbiologists, phylogenetic studies, and historian, cultural anthropologists to do that. But certainly, there's some facts now. If you look across the globe, some places are more affected, like you said. Some are less. Some countries are more affected. Some countries are less. Even in the same country, if you look at Italy, for example, if you look at the facts, there was a fear that the southern part will be more affected than the north, because, for example, of public health data, that number of bed, etc. So, but in reality, the north was more affected. That's one observation. It varied from region to region, country to country. Number two, according to the latest research finding, and I insist here that everything we talk about science today that may be confirmed by data may be wrong, not false tomorrow. But according to the virologists, they have identified already 3 strands of this SARS-CoV-2. Now they identified 3. Maybe there'll be more in the future. And there's no question that for myself as a medical doctor, without being an expert in infectious disease, that different strands of the same microbe may have a different virulence, more serious for that. And so there's a many factor, and the cultural dimension is, like Pisit mentioned, the distance. In Cambodia and Asia, we're not very close to people. Like in France, people are very close. Italian are very close. And so that's another observation that need to be kept in mind for the future. And also the spread of the virus also depending on the structure of the family. Like in Italy, like Cambodia, 3 generations or Asia live under the same roof. So that is a factor that may favor the spread. So there are many observations, but this question, Professor Anderson, definitely is a puzzle for all of us. And there are belief, the practice, but actually pandemic is a dynamic interaction between viruses and human, and the culture, behavior will affect on that. And that is why in the future, I will end here that people ask, how would you predict when to lift up the lockdown using that famous bell curve that has been established by the famous William Farr, 1840, that have proven right in over centuries and across the pandemic. How can you predict that in the future? But to predict a combination of a behavior of a virus that is new to us, there are 1 million at least virus species in the biodiversity. We know, scientists know about 3,000. So a bit of humility is important in the, and this is the key word to me during the pandemic. Be humble, be humble. And then the behavior of people are different. Culturally, you look at our people in Cambodia here, when we learn about this pandemic, they saw somebody who fainted in the street. You think this is COVID, they go to hide. And now, after 1 month of no new cases, they're all out there. The social distancing is less of a respected, but overall, we don't know much, and a little bit humility is important. But the question, I think in 1 year time together, thank you for raising that question, Professor Anderson. We should look at why is that affecting some region more than others. This is very important for different measure in the future. The last point I forgot to mention, in this part of the world, we live with viruses. There's no wonder why the tropical disease was invented by the colonial European, because we exposed to this microvirus for forever, and it creates a kind of a immune system that may cross across the species of micro. But this is pure speculation. But in 1 year time, let's meet and look at that question, which is to me intellectually interesting, historically important, and with impact on policy and public health. Thank you.
Thank you.
Professor Surya, I saw you had your hand up.
Yeah. Yeah, I think the story that Anderson said about the immune system has been also actually said in the newspaper, at least in the early time, that Indonesian immune has a a certain genetic that basically benefit from a certain genetic. So that's why coronavirus has not hit the country. Yeah. But the thing for Indonesian perspective, I cannot speak from other country, that I personally still not able to say whether it is caused by the genetic or caused by culture, unless the data, that's two things. First is the testing, that with low testing, we absolutely cannot tell a lot about what exactly the pattern of distribution of this virus, because a lot of people cannot actually not have the symptoms. The second one is actually the data from how many people actually died. And that is very much also, it's not saying that untransparent, but the way the Indonesian government put the number of people of death from either suspected or already positive. That is the one that we felt unclear, at least from the data that every day they show us. For example, this is the just example. In Jakarta, they say at least 430 and something people died. I'm trying to find out the exact number, but actually now the government of Jakarta already tried to put how much the number of people die recorded as COVID-19, and the number is higher, like some more than 2,000 now. So why that discrepancy happened? Again, back to the tests. For a while, the test is very low and very long and controlled and not decentralized. So we are not able to read in terms of data, and cannot actually understand about the pattern of COVID-19 pandemic in Indonesia. So for me, at least from Indonesian case, it's hard to say whether it's a warm weather, or is the pattern of mobility, or a culture or practice, unless the full test, high test, and also all the people that it's actually we read that data. So that is my comment. But it's interesting to actually learn about, why even in Indonesia, it seems not, the effect, it's not compared to the other countries. Thank you.
Thank you, Surya. I guess one thing we could also think is that people of Southeast Asian heritage don't only live in Southeast Asia. So we could look at case numbers for Southeast Asian Americans, for example, to think about that further. I saw Mary had her hand up, and then Hien had her hand up. Are you unmuted? Huh. Okay, let's go to Hien, and we'll see whether we can get, see what's happening with Mary's mic while she's talking.
I just want to make a very quick comment about microbiology and actually genetics that in Vietnam. It is interesting that even though Vietnam has a border with China, most of the cases that are positive in Vietnam, the genetic signature comes from Europe, mostly from the UK. And that is also the case for cases in the US too. But I actually have a question for the panel, and has more to do with the social narrative of the virus. As Mary Callahan said earlier, there is a narrative of this is a disease of the outsiders. I know that as an Asian American here in the US, very early on, we, the Asians, were treated like either criminals or, the virus. We were the virus. People spat at us. Businesses were vandalized and all sorts of stuff. Well, the same thing happened. I know, at least in Vietnam, my friends and family who are Westerners who would say, yeah, there was some people who look Westerners would be refused businesses because the locals perceive them as infected. And but soon after that, the prime minister got on the air and said, "You're not supposed to make them to tell the citizens that we're all in this together." Now, I haven't heard if that had very much effect. What is it like in other countries where the panelists are as far as that narrative?
Thank you. I think we're going to go to some questions from our audience now to make sure we have a moment for people to really weigh in. Here's one question. Could participants please talk more about how COVID-19 is exacerbating existing social and economic inequities in different countries? Thank you so much. Let's see. Would anybody like to take that? Mary, do you want to give it a try? Oh,
okay, yeah.
Could it be related to your headset? If you took your headset off?
Can you hear me now?
Yes.
Okay. So I think that that when people talk about COVID-19 in Myanmar, it's a placeholder for two things. It's a placeholder for the pandemic itself, the health condition, but it's also a placeholder for the devastating effect the global pandemic has had on the economy. And so this economy is going to take years and years to recover from this. The Myanmar economy has become more dependent on China, exports to China, which China has sealed the borders for. And also that the economy over the last 30 years has become extremely dependent on remittances. And this is especially true for the population that is living below, at, or just above the poverty line. And so these migrants, there's 4 to 5 million Myanmar migrants in Thailand, and tens of thousands have already come home. They have been locked in cages. At least another 30,000 have registered to come home. It's likely that we could see 1 million or more come home, and they're just going to be more mouths to feed. They're not going to have any capital to bring with them. And the amount of devastation the economy is facing is quite serious, and it's preeminent because farmers need money in the next 2 weeks for the paddy planting season. And there's no local credit, there's no government credit, and there's no remittances coming back. So we're on the verge of a very severe farming crisis, which could lead to a food security crisis.
Thank you. Reti.
Regarding that question, the pandemic revealed the gap between the rich and the poor. There's no question about that. It's obvious, but there's so much research to be conducted in the future. I want to share just one example. When schools are closed, particularly in young kids, primary, secondary school, people sell this online learning. I'm a digital guy, I love that. But just imagine one situation that a family who has limited resources live in a cluster at home, very close, small spaces, noise. The kitchen is a classroom. Parents have limited education who cannot replace the teacher, don't have access, bandwidth. So all this will disrupt the normal life, and particularly the access to school, proper schooling for kids. So as long as it is not too long, that would be one impact on the education. And so this is one, definitely I believe that this pandemic with the social distancing will affect mostly the poor. Just one second, regarding that genetics, I have to go back there, but in Southeast Asia, there's one scientific fact that, the prevalence of a genetic disease of the blood called beta thalassemia, THALASSEMIA. It's quite common in Thailand, Cambodia, Laos, 25–30%. And it has been demonstrated scientifically, but those people with that gene that affect their blood are resistant to malaria. I cannot extrapolate that, but this is one factor to consider in our thinking and research in the future. Thank you.
Thank you. I will give us another question here. Is it possible that the pandemic will help increase the collaboration between Southeast Asian governments to work together to develop policies regarding the situation?
Interesting. Yeah, can I just briefly say that this is interesting to observe that I think what happened, the way I observed that everybody, each country struggle to do whatever, to contain the virus in their own country. And although I'm, now from Indonesian side, for example, that our foreign minister are approaching, like South Korea for help in terms of testing chemicals, or so I think the way I see it, that people are busy with their own countries, and I don't know whether there is beginning of talk to each country about whether, because it has, to actually overcome the fact that in Indonesia, for example, the government in terms of economic, that might already thinking about open up, businesses, even though the coronavirus, the number of the, of people get the virus, and that it's still not, substantially low. And it's already happened now, especially in the Ramadan, where businesses, this is the time, like, Christmas in US, or other places, major religious time, where everybody actually has to prepare something. So there's already shaky policy in the government that allow certain businesses open and mall open. It's already happening, and we, some of them are upset, but that's the reality. And what a fact is that if each of us has still of Indonesia still have the virus, then how possible traveling each country, or even um, trade and things like that happen. So yeah, I haven't seen that, at least from my observation, or maybe I'm wrong.
Hien, do you have something you'd like to contribute? I saw something in the chat. I wasn't sure whether that was for you wanted to discuss, or.
So it's just that I'm sorry, I was thinking of what Dr. Cham said about thalassemia anemia in Southeast Asia. In Africa, also the people with sickle cell anemia are immune, what's the word, tolerant to malaria. So I don't know. I don't know if there is anything to that, but it is an interesting observation. It is something that needs to be looked at scientifically. Yeah, I apologize. Just wanted to mention that.
Yeah, thank you. Okay, our next question is about conspiracy. It says the US and other Western countries have generated various conspiracy theories about the genesis of this novel virus. How has Southeast Asia received these conspiracy theories? And I would add, what conspiracy theories have been generated from Southeast Asia? Yes, Professor at the. Oh, you're muted.
I didn't have a chance to answer the previous question, which is very important regarding, give me 1 minute, on the question on how pandemic would affect the regional cooperation. Actually, there is very active regional cooperation. Since SARS, also ASEAN, since February to now, there were at least 3 summits on COVID. ASEAN COVID in Laos, I went there, between Minister of Foreign Affairs, and then ASEAN +1 with China, and then ASEAN +3, Korea, China, and Japan, and then ASEAN plus US. There's a lot of agreement, at least, that have trickled down to the policy level, multilateral collaboration, cooperation, exchange of data, and bilateral, particularly discussing with the government of Thailand regarding our workers there. So there increased intense collaboration, and actually one of the Central Asia Vision Institute here, Cham is looking at comparing the collaboration during SARS and now. So now to come to conspiracy, it's a very interesting time. I have more time. I have done some research. I want to write a paper on that. When you face something uncertain, threatening, humans are very, very creative. A lot of imagination, and think if I were had to have some money, I will make some thriller. It's amazing. So you look at history conspiracy from even from the Greek time. You know, every time you have a pestilence, there's a blame game. The Jews put white poison in the well, etc. So all of this, there are not much of anything to support. And I feel sorry that conspiracy has been used at the highest level. It doesn't make sense at all, but it's too short to it. But the conspiracy theory have no scientific background to support at all. It's just this insecure people, paranoia. When is among the folk, you know, discussing among friend conspiracy is fun to spend time because we are confined at home, it's bored, conspiracy blame. But when it's come the conspiracy theory elevated at the higher level of state, is very, very annoying, and is destroy trust and undermine international collaboration, solidarity in a situation where solidarity is so important to fight this pandemic, because we live on one earth and one pandemic. You know? Thank you.
Thank you. Does anybody else want to jump in on conspiracy?
Yeah, I'd like to address that. Very early on, before it became, before the WHO even called a public health emergency of international scope, there have been conspiracy theories circulating around the Vietnamese communities overseas, at least in the United States, about this coming from China, about China manufacturing a bioweapon and so on and so forth. And because of the tension, existing tension between China and Vietnam, and a lot of groups, overseas Vietnamese groups outside of Vietnam, use that as a way to say that the Vietnamese government is not protecting its citizens, whatnot. The Vietnamese government tried to put a stop on that pretty quickly, and they would find people who propagate fake news. They call it fake news there in Vietnam. Now, of course, there are concerns that this law or new decree about stamping down fake news would be used later to suppress freedom of speech. But my response to that is the Vietnamese government didn't need that to suppress freedom of speech. So, but this is something that will affect the lives of the whole country, of the whole planet. It's different, and so I guess it remains to be seen if that decree would make it worse for freedom of speech in Vietnam or not.
Thank you. Pasit.
How people call upon one another about the COVID-19, especially among or against the Chinese, even though Chinese is one of the big player in business in Cambodia, also in Asia or around the world. When the pandemic of COVID happened, people just see that, oh, we just keep ourselves in a distance from Chinese when we found them. But later on, we see also that people keep themselves away or like in a distance from the European as well, because they do not wear masks. And also in general, in what we see here is that we see that wearing masks is a way to secure ourselves. So when we do not see people do not wearing masks, then people start to distance themselves. So the conspiracy regarding the COVID and how this been originated, been played in politics, for instance, like by the US against China or China against the US. But also we can see how people perceive the concepts of COVID among Chinese as well as against the West from our Asian context. And I believe different countries have different experience, but somehow we can see the general perceived understanding regarding the Chinese and the Europeans or the West from our Asian perspective. Yes, thank you.
Thank you, Vince.
Yeah, this isn't so much about conspiracy, or rather, I was thinking about how can we tweak conspiracy, which, I mean, in some ways, arguably is much more dominant in Western discourses about the virus, and instead move to something else that actually, Celia, you talk about in your own work, which is the question of superstition. You know, what are the superstitions that attach to COVID-19? You know, keeping in mind how superstitions are both narratives about natural events, but also narratives about natural events that otherwise can't be explained, but also narratives about power and power relations, right? So I'd be very curious to hear from others. What are the popular beliefs that, you know, which might call popular epidemiology around the coronavirus? Is it witchcraft? Is it haunting? Is it ghosts? Is it, you know, be very curious to hear. Yeah.
Is it?
You hear me? Yes.
Yes.
I think here it links to some of the common practice at in different community. I remember in the past when we had like the spread regarding the SARS and so on, or any kind of plague in the country, people just have different belief of this and that about whether it comes from the bad air, it from the nature, and people just believe if you eating this, for instance, eating beans can help you against something like that. So again, here during the COVID-19, there were also some popular belief of what they should do in order to prevent themselves from getting COVID. And I think Southeast Asians have diverse belief because we have like diverse also roots of culture in nature, and this also link to what we perceive as God or goddess or devils. And I just want to share that from Cambodia, different community still see that COVID is caused by bad air. People like the other common plague because it can cause death, and people just believe that by using how to say the supernature, like the Tingbong that I just mentioned in my presentation, to chase or to scare away those bad spirits. It would help to protect people in the community from this COVID-19. Yeah.
Right. Thank you. Anasorn, I'll let you speak, and then if one or two people have any concluding comments, I think that will be it. We don't want to try the patience of our very beloved audience here. So go ahead, Anasorn.
Okay, thank you very much. I think in terms of superstition and magic, you know, it's very interesting because in Thailand, although we are the countries that, you know, are full of superstition and magic, we don't see anything like this, you know, coming out when during the times of pandemic. To me, it seems like the triumph or the winning of medical knowledge, either in terms of explanation of the cause of the virus and also the measures in dealing with, you know, the spreading of the pandemic. We don't see any alternative knowledge, either, you know, from those from, you know, medical doctors, which, you know, I think they are diverse. But we also don't see any alternative forms of healing, you know, of healing those who are affected. Maybe because we have a low number of those who are infected, because just only 3,000, and now they got the recovery, so we don't have that. But anyway, to me, this is the successful collaboration between on the one hand those in medical science, and on the other hand those in power who use emergency decree or something like that. And to me, although we can subsume the virus, but what we will face in the future is that how could we get out of the grip or the control of the scientific knowledge, I mean which is has a narrow basis, and plus the way in which we deal with the situation, which will legitimize the use of force, and also the authoritarian regime.
Thank you, Ajahn Anasorn. Does anyone want to say any concluding words? I see you're trying to get in there, Ibu Surya.
Thank you, Celia. Yeah, I think from the Indonesian perspective, I see the tension between scientific fact and people believe on spiritual belief in something, and this tension. So at the beginning, I said, as I show in my presentation, that it's people trying to say that we shouldn't actually prioritize the scientific facts over the religious beliefs, and now there is a balance. I don't know. It seems like a balance, and whether this balance will further move to a very productive discussions about this to tension. I think that is happen to say. I mean, interesting for Indonesia to see how this these two balance could be productive in rather than unproductive. So that is my conclusion of this panel. Thank you.
Okay, Hien, you had your hand up next.
Okay, thank you. I have two conclusion remarks to make. One is that genetics and superstitions aside, I believe that for something like this, a pandemic like this, it's new and nobody knows where it's heading, how to respond to it. The key here is decisive action very early on, and having coordinated efforts with the right people, with the right skills and the right tools, acting at the right time together to stem the spread of the virus, whether it's the new coronavirus or something else. But the other thing is that escape my mind is that in the case of the Vietnamese government, it was successful in rallying the country. It was using like wartime mode to rally the people behind it to work toward a common enemy, and this what it has a historical precedent. The Vietnamese government was very successful in rallying its people during wartime in the war against the Americans. What it didn't do very well was managing the peace once the common enemy has been conquered, shall we say. So what remains to be seen is how will it manage the economic recovery, and like somebody asked earlier, how would it ensure that people who are most vulnerable will be able to also get recover and get lifted up with the rest of the country.
Thank you. We will give Reti Cham the last word.
I'm the last to speak, but I don't want to have the last word to express my humility. And I'd like to take on the concluding work of Professor Surya. Thank you for bringing very, very interesting point. Is this pandemic a new virus? We don't know much. Science is uncertain. So it's how to manage, mitigate between facts and fictions. And there's a concept that I researched over almost 10 years now that I used during Fukushima disaster. It's called the post-normal science. Many of you may have heard about that, social studies of science. Is that as a scientist, we deal with uncertainty, and when we disagree, technologically, methodologically, we have a way out of that through using statistics or peer reviews. But when you bring this science outside to the what Ravitch and Fentovich call the post-normal science, it's another issue. And the pandemic applies very well as much as nuclear disaster, genetically modified food, climate change. There's a lot of fighting because we don't understand this concept of post-normal science that apply to situation where it's urgent, values are contested, the stakes are high, etc., etc. So when you bring this, and I found during my research and some publication and reading the literature that during pandemic or nuclear disaster, the best way to mitigate that is through narrative. So this seminar to me is fantastic because we found out that when we bring data, facts to the people, they don't care about the facts, the public in general. They don't care about the scientific fact. They run away. They want narrative. They want a story so that they can connect to their life. It disrupted their life. They lost families, etc. So it's the same situation. So in the future, if a few of you are interested, I welcome some people to work together to look at this pandemic from the post-normal science that put really narrative. And there ain't no better narrative storyteller than the cultural anthropology. So really, I'm very happy to be part panel. And again, Celia, my colleague, it's a great honor, pleasure to be with you. I learn a lot, and I hope that my wish is that we continue the dialogue, and dialogue that lead to publication, scholars of heart, article. We run seminar, and hopefully, when this pandemic is over, we are happy to run a conference here in this region with all our colleagues every 2 years, because pandemic, the COVID is here to stay with us. That's the biological facts. And there will be more pandemics in the future. And let's take this opportunity to learn, to mitigate the fear through narrative and this approach through anthropology and this interdisciplinary approach that I value so much. Thank you very much for organizing, Celia, and your team from University of Washington. Thank you.
And thank you, Professor Cham. Thank you to all the panelists. Thank you to our staff and Professor Marwick, who have helped behind the scenes. And thank you to our audience listening in on YouTube.